Hello and welcome to Health Check. My name is Grace Mutiso. Tonight we'll be focusing on epilepsy and we'll be asking ourselves a few questions. Is there hope for anyone who has epilepsy, or if you have a child or a loved one who is epileptic? Is there hope for them? And we'll also be defining what is epilepsy. We'll also get an opportunity to interact and engage with the guests that we'll be having in studio. This evening, I'm hosting Reverend Fredrick Beuchi, who is a co-founder of People with Epilepsy organization. He'll be letting us know more about this organization and why he founded it. And I'm also joined by Dr. Gad Igiraneza. I hope I've gotten it well. And Dr. Gad is a physician. He'll be helping us understand more about epilepsy. Remember, this program is live on Facebook and YouTube via our handle at Hope TV Kenya. You can contact us for any question via WhatsApp number 0708 222 323. That is 0708 222 323. And you're welcomed on tonight's episode of Health Check. My name is Grace Mutiso. Allow me at this point to introduce my guests and allow them to say hello to us. Let's begin with a common face. Our very good Reverend. How are you doing, sir?
I'm doing so well, Grace.
Yes.
Thank you so much for the opportunity to be back here. It feels so good to be back.
Karibu sana.
Yes, and maybe for the purposes of our viewers, my name is Reverend Fredrick Beuchi, and I'm an epilepsy awareness activist. Last time when I came here, I had not moved to work with the hospital. So right now I serve as a chaplain at the Maua Methodist Hospital. And it has been a good journey so far.
Yes.
Yes.
Okay. We'll be coming back to you shortly to tell us about the organization you've co-founded and why you're passionate about persons living with epilepsy. Karibu sana mgeni.
Thank you.
Introduce yourself to us.
My name is Dr. Gad Igiraneza. I'm a family physician by training, working in Maua Methodist Hospital as well, same hospital as Reverend. I also serve as the medical director there. So I do both the clinical aspect of it, but also the managerial aspect of it. I am passionate about whole person care. As a family physician, that's my bread and butter. Super excited to be here with you.
Yes, welcome. I had to say your second name slowly. Lest I baptize you with a new name. And I've noticed you've pronounced it with a certain intonation.
Yeah.
What does it mean? What does your name mean? Your second name?
Igiraneza means God does great things.
Wow. Okay.
Yep.
Let's get into profile to understand more
about that. Right.
Let's get to Reverend Beuchi. You founded an organization that reaches out to persons living with epilepsy. Would you give us a little bit background on that?
Oh, yeah. So Foundation for People with Epilepsy was founded on the grounds of me being a caregiver of a sister who was diagnosed with epilepsy when she was 2 years old. And of course, we were just catching up to know how she's doing.
Yes.
And I was reporting how the Lord has been so good. Of course, that coupled up with, the treatment journey that we've had. She's now 16 years old and she has been seizure-free for about 6 years, which is a very positive thing and a testimony, so to say. And in the midst of all that, we thought, like, the experience of taking care of a person with epilepsy really takes hands of so many people. And we were like, we have so many other people who perhaps don't have people who can really support them in the journey. And that's why we founded this organization, to see how best then we can provide the necessary support for them to feel loved, but most importantly, for them to know that epilepsy is a condition that is manageable.
Yes.
With medication and with the proper care that is supposed to be there. So basically, that is what actually pushed us to come up with such an organization.
Okay.
Yes.
And then before we bring in Daktari, there is a celebration around epilepsy that will be happening this week?
That will be happening, I think in a week's time. The International Epilepsy Day happens every second Monday of February.
Yes.
So this time it will be on 12th of February. And the theme this year is stamping out stigma for epilepsy.
Yes.
So when we begin to talk about the stigma that comes with epilepsy, it's a whole other topic. But
True.
everything that we are doing from this week moving forward, it will be all about trying to see how we can destigmatize people with living with epilepsy, and also demystify the myths and misconceptions that surround epilepsy.
Okay.
So at the moment, we can't say we will have one event happening at a particular place.
Yes.
But like Saturday, we had an opportunity to bring medical students together from, again, the Methodist College of Health Sciences. And we participated in a walk, like a hike.
Yes.
And we accumulated over 700,000 steps, and we added them on the global platform where the campaign is happening.
Yes.
And in the coming days, we'll have a series of such events also happening. So I think we'll keep giving information as they come.
Okay.
Yeah.
Thank you. Allow me to bring in Dr. Gat now. Somebody will be asking, so what is clinically termed as epilepsy?
Right. I was thinking about Beuchi's 50 million steps.
Yes.
We were walking around town today, so I think we contributed to those
How
today.
many
did.
steps?
We really did.
Yeah, we
that was
will-
quite some
we will-
steps. Yeah.
It was.
It was
Oh,
quite some steps. Yeah. So, when you're talking about epilepsy, I get a lot of people sometimes confuse the word seizure with epilepsy.
Yes.
Okay, and they either use them interchangeably. Well, actually, epilepsy, if you try to say it in a layman's language, is like an accumulation of seizures. Okay.
Yes.
So if you have like one episode of a seizure, of a convulsion, you don't necessarily have epilepsy, but it is the frequency of the seizure and the longevity of them and the frequency of them happening that actually defines epilepsy. So to try to help people understand, patients who have epilepsy are the type of people who either can have like jerky movements of their body involuntarily. They're not necessarily controlling it.
Yes.
They can have clonic, which means like their muscles become, tonic, their muscle becomes so stiff that they can't relax the muscles. And most of the time, it is usually accompanied sometimes with loss of consciousness. So these people, when the episode of the jerky movements and the rolling of the eyes sometimes happens, they don't remember what happened when they regain their consciousness. In the medical term, you call that retrograde amnesia, which means you don't remember what happened before when now you regain consciousness.
Yeah.
So epilepsy is more like convulsions or seizures that happen frequently. And there are usually different causes that can cause epilepsy.
Okay.
Yeah.
Before we go to the different causes of epilepsy, apart from seizures, are there other conditions that people can mistake for epilepsy and yet it's not?
There are conditions that are like pseudo-epilepsy.
Yes.
And usually most of the time, you can see some of these conditions in like young adults. People have like some psychological issues. Maybe they are not performing very well at school, or they need a little bit of attention. So they do what they call to fake a seizure. Okay. It's like a pseudo seizure, but it's not a seizure. Most of the time, even if they fall down, they'll probably fall down with a lot of caution, because it's not necessarily a seizure.
Yeah.
But beyond that, I'm not trying to put the young folks on the spotlight. There are other conditions like syncope, like fainting. Okay. People can confuse fainting with epilepsy. But usually fainting is like a small episode where you kind of lose a bit of consciousness for a few seconds, and then you regain it back. And usually the big difference between like fainting and epilepsy is that usually when you wake up from the fainting episode, you usually are able to remember what you are doing or the things that you are attending to. So those are like some of the differences between epilepsy and other neurological conditions.
Okay. So let's move to some of the causes of epilepsy. Yeah.
So epilepsy has a variety of causes. You can think about it from a genetic point of view, from a traumatic point of view, from an infectious point of view. If we say from a genetic point of view, there are people who are more genetically predisposed to develop epilepsy. These are some people who have genetical mutations in the mechanism of how epilepsy usually happens. So they didn't do anything per se. It's not because they did something to have it. It's just a genetical problem.
Yes.
And there are other causes like trauma. People who have repetitive trauma to the brain, who have been in accidents or who have hit their head so hard, those people can actually be prone to getting convulsions initially that end up developing into epilepsy. There are also infectious causes. In Kenya, in some parts of Kenya, you know that there is prevalence of malaria. You've ever heard of cerebral malaria?
Yes.
Children who have had cerebral malaria can end up developing epilepsy on the long run because of the assault of the infection to the brain.
Yes.
Same thing like meningitis, anything that is infectious that can affect the brain is more likely to cause epilepsy on the long run. But in addition to that, there's also things like cancers, brain tumors and all, any malformation of the blood vessels within your brain. All these things actually can cause epilepsy on the long run. So it's good to kind of have a picture of what might be causing the epilepsy, because then you help your patient to orient them properly. And some of these causes, you're going to get them from history.
Yes.
What happened when you were a child? Did you get sick? Were you hospitalized for an infection? Or were you involved in an accident at some point? Or are you getting these headaches that they don't resolve even if you take your painkillers? They're always there and they're just bothersome. And some of these patients, you can orient them and say, I think we need to get imaging of your head. And you realize that they didn't know, but that they had like a brain tumor.
Yes.
And that was the leading cause to the epilepsy. So yeah, those are the main causes.
Okay. So it's not, what do you want to say? Communicable, like associating with Reverend Beuchi. I can get, the way some people say, I think I noticed I began having this when I associated myself with somebody who had the same condition.
No, that's a misconception. And I think such misconceptions can prolong unnecessary stigma. Epilepsy is a chronic condition. It is not contagious.
Yes.
Nobody can transmit it to somebody else. You can have what I had spoken about genetic predispositions. If probably somebody in your family had seizures and another relative in the family had seizures, there's a possibility that another person within the family can have it, but it is not infectious by nature. And I think it's important for our viewers to know that it's not infectious.
Okay. Yes. Thank you, Dr. Gad, for that. So, Reverend Beuchi, you're so passionate about epilepsy and you're doing so much about this. Would you give us a background info about that?
Oh, yeah. The passion for epilepsy awareness, of course, goes back to me having found myself in a family of 5 siblings and being the firstborn and our lastborn being born, and then a diagnosis of epilepsy happens. Something that we truly never imagined. In our village, I only knew of one person, and it happened that this one person was known by everybody because it was a rare kind of a condition to see.
Yes.
And then it happens that it's there in the family. So while we were coming, I was just sharing with the Daktari. that I was already working in the shipping industry, but things were getting bad for my sister, with the frequency of seizures happening after like every 20 minutes for her, and it was bad. So I quit my job now to come home and start helping my mom take care of my sister. Because every time would go to work, come back, you didn't leave your sister with a head injury, a cut somewhere, and they are all there.
Yeah.
Right.
So sometimes it felt like, is mom not taking good care of this sister? Until I stayed with her for like 2 weeks.
Yes.
And I realized, wow, this is very difficult for mom. But sometimes when she looks like she's okay and then you leave her, the next minute, you know, you hear a big bang and somebody has fallen down.
Yeah.
So it meant then it's either I'm there to stay with her full time so that mom can do the other works, or I take on the house chores for mom to stay with my sister.
Yes, those were the only options.
Those are
you
the
had.
only options.
Yeah.
And I thought, well, because she has been with her and she needs that time to be with her, she would do the sitting down with her, and then I do my other, you know, the house chores and everything else. Of course, being the first one. So that is where the journey began. And one day while doing the house chores, I see an interview on TV, and doctors are talking about epilepsy for the first time. They're going to have an epilepsy open day in Nairobi. And I decide to come. And that is where I was able to find one of the epileptologists, and I explained my case. And it happened that they have, a clinic that they visit once a month in Mombasa, and said, you bring your sister, let's see what's the problem. And they were able to do a proper diagnosis. They found out what type of epilepsy she has, and they put her under medication. And for me, it was like, if I ever wake up one day and my sister stays seizure-free for just a day, I was really praying that God, one day I just wake up and I stay with my sister for a whole day without a seizure.
Yeah.
And I would not go back to my shipping job. I'd go back to college, I'll study theology, and I will serve you full time.
Wow.
So that was that was the covenant.
Yes.
And so 6 months into her having started the treatment, one day we wake up and I watch her literally spend the whole day without a seizure. And that was a confirmation for me. I said, okay, I think now we are on the right track. And because I promised this God,
Yes.
I'll go back to school. So, went to St. Paul's University and started my theology. And it was because I had an agreement with God.
God. Okay. Would love to come back to you and hear how the journey has been, still taking care of her until date. But let me come back to Dr. Gad. Reverend Beuchi has mentioned there are different types of seizures.
Right.
What are those?
So, from a general perspective, seizures can be classified, if I oversimplify it,
Yes.
it would be like partial seizures and generalized seizures.
Okay.
So partial seizures are like, they are like involving a small part of your brain, while then the generalized seizures usually involve the whole hemisphere of the brain. So it's good to kind of make that distinction. Even in partial seizures, you have simple partial seizures and you have complex partial seizures. The simple partial seizures, usually patients don't lose consciousness. Okay. And sometimes they can be difficult for patients to actually appreciate them. Some patients who have simple partial seizures would either develop like a funny sensation in their belly, or they'll get a sudden outburst of fear, or they start to see like flashes of light. And then maybe some of them would end up having like shaking one arm or one leg is shaking. And most of these patients are the patients that spend a long time going from one clinician to another. And sometimes they don't get a proper diagnosis until their partial simple seizure is evolving to become partial complex seizure. And now when they get a partial complex seizure, these are patients now that would now starting to have like jerky movements on one side. Probably sometimes the movement can start on one side and then it develops on the whole side of the body. They'll end up getting loss of consciousness now. They don't remember what happened.
Yes.
Some of them, of course, will even have problems when they're in that ictal phase, when they're having a convulsion. They might end up either biting their tongue or injuring themselves. And sometimes they might even lose the capacity to hold their urine. So when they wake up from an attack or from that convulsive episode, they found that they've already soaked their clothes, which is quite... Even when it is happening in the young people, you can imagine how distressing that can be. That's why it's important for people to destigmatize epilepsy and understand that these are conditions that are treatable. Now, those are the partial parts. Now, you have the generalized convulsive disorder or epilepsy. The generalized one, usually it can be tonic, so the muscles become very stiff. It can be atonic, when the muscles become very less stiff. So when patients are having like a tonic episode, these are patients that will tend to, if they are getting the episode because the muscle become too tense, they fall backwards.
Okay.
If they're having an atonic seizure, because then the muscles relax, these are patients that will tend to fall forward. Then there are patients who have tonic and clonic. So they have both the tone, the stiffness, and the jerkiness of the muscle groups. And usually for generalized seizures, they're usually accompanied with loss of consciousness. The patient will not remember what happened. And because of the jerky movements that usually involve the whole body, they're at risk of injuring themselves, right? They usually also will have the inability to hold urine, sometimes even the inability to hold feces. So they can, do that on themselves. And then after, the episode usually lasts 2 minutes to 5 minutes. But if it lasts more than 5 minutes, it is usually a medical emergency.
Yes.
Because during that time when the whole body is shaking, the oxygen is not getting enough, the brain is not getting enough oxygen supply, and they can cause some severe lesions to the brain. So those are the type of seizures that you'll encounter.
Yeah. It sounds really sad. Like
it is.
I'm imagining what the patient, what they are going through at that point. Yeah, I know we'll get to what support can we give this person, but just explain to us in a simple term that Tari.
Yep.
So if this person gets, the muscles being stiff or being loose, what's happening in their body? Because you know the medical beat, but break it down to us so that the normal Mwananchi can understand how to support.
If I try to explain it in a layman's language, your brain is composed of cells.
Yes.
So these cells send messages to each other. It's like the cells in the brain are talking to each other. They are sending messages to each other.
Yes.
It's more like an electrical signal that they are sending. So one cell is usually connected to another cell, and there is a cell that sends the message, which is like an excitatory cell. And then there is another cell that gets to relay the message. So with all those cells that are happening in your brain, sometimes the cells fire or send a lot of electrical impulses that overcome the capacity of other cells to stop that electrical impulse. So now the electrical impulse goes into an overdrive.
Yes.
It is constantly there. So because of that electrical impulse that is constantly there, you're depending on where in the brain that overfiring of the electrical impulse is happening, you'll have symptoms.
Yes.
So if it is a small part of the brain, probably what you'll get is like shaking one arm. If it is generalized in all the parts of the brain, then all the whole body gets into this tonic, clonic, and shaking and losing consciousness, frothing in the mouth, losing the capacity to hold urine. And now that's when that because of the jerky movements and all, that's why most epileptic patients are at a risk of injuring themselves, because when those shakiness are happening, they are not aware that it's happening. So anything that is in the vicinity, in their environment, can cause them harm. So it's more like electricity that is sending the signal that goes into an overdrive. And when it goes to an overdrive, it affects the body depending on which area of the brain is affected.
Okay.
Yeah.
Allow us to pause here and catch a break. When you come back, we'll be asking Reverend Beuchi, how was it for your sister? And also we'll be getting opportunity to find out what first aid should we give to any of our loved ones who has epilepsy, and where can parents get help. You're on Health Check right here at Hope TV Look and Live. My name is Grace Mutiso. I'm hosting Dr. Gad together with Reverend Fredrick, and we are talking about epilepsy. Engage with us at Hope TV Kenya on Facebook and YouTube. Our WhatsApp line is 0708 222 323. Yes, 0708 222 323. Let's have this quick break. We'll be right back.
In order to keep hope alive in the airwaves, Hope Media has a couple of initiatives. Friends of Hope. Friends of Hope is you and I forming a team of well-wishers and volunteers who give in cash and kind to support in spreading the gospel at Hope Media. Currently, Hope Media is running a campaign under Friends of Hope dubbed 100 for 1. Through the campaign, Hope Media is asking Hope FM and Hope TV listeners and viewers to give just 100 shillings in order to reach one more soul with the message of hope and the gospel. Engage with us on our social media platforms at Hope FM Live and at Hope TV Kenya. Kuwa rafiki mso leo.
Welcome back to Health Check right here, Top TV Look and Live. My name is Grace Mutiso. We're talking about epilepsy, and I hope you're learning a thing or two. And if you know anyone who is suffering from this condition, please share our YouTube link with them so that they can join us and learn together. Or if you have a loved one, you know, who is going through this condition, or you're the person going through and you have any question, please engage with us. The numbers and feedback platforms are right at the bottom of your screen. Allow me to bring back Reverend Fredrick and Dr. Gad. And Reverend Fredrick, before we went on a break, I wanted to hear from you as a caregiver. How was it for your sister? Which type was she suffering from? And how was it being a caregiver to her?
For my sister, it was generalized because it would involve the whole body. And then it evolved over time, especially when she started now using medication. So she wouldn't really have an attack where she shakes with the whole body, but she would have what we call now drop attacks. Like she's standing and then all of a sudden, something happens and then she drops and she hits her head or something like that. But what we realized the medication was doing was really trying to arrest those type of seizures as they went by. And then it got to a point where she would only either have a shake of the hand or rolling of the eyes without her necessarily falling down or shaking or anything. And then over time, the seizures were not happening unless they are triggered by something, because they are also triggers.
What do you mean by that? Explain a bit on that.
Okay. So for triggers, it would mean even when she was so well controlled with medication, and the seizures were being managed, every time, now that she was growing up to become a teenager and started experiencing her menses, that would be a trigger, because she would either experience some headache or some stomach rumbling like that, and that would. The other one which I noticed the other day was every time she would be so excited over something, it would also trigger. So I would buy something for her, and you can't just walk and say, surprise, I have a new dress for you. She gets so excited, and then the next thing, it's a seizure happening. So, but over time we had to learn these things, and then it's good. Even for other patients, it's good that they understand their seizure triggers so that you don't tell the doctor that seizures have not stopped and then medication is increased, whilst the medication that you are using, it's really working.
Yes.
You just have to understand your trigger. So you have others who have what we call the photosensitive seizure types, where if there are flashlights, you even have programs before they start, they have like a disclaimer.
Yes.
A lot of flashes for this, so you kind of like avoid that. Stress. And also when you're using those anti-seizure medication, you should not, take alcohol and abuse all other drugs, because they end up also. There are people who, if they're stressed, that's also a trigger for them. So it's good to understand those triggers, and it will be best if someone is able to know how to control them.
Okay.
Yes.
So for Dr. Gad, how is epilepsy treated? Is it one fits all? Is it medicine that will sort you out, or there are non-medical ways of getting treatment?
That's a very good question. Reverend Beuchi touched on the triggers. It's really important for even the audience at home to actually know that, because the triggers are, if people have epilepsy and they get to understand the patterns of their triggers, that also is a way of actually managing epilepsy in a sense, because you can get to tell what are the things that actually, when I experience them, I get the attacks. So that's really important. Now, when you're talking about treatment, remember when I talked about different causes of epilepsy?
Yes.
So, for instance, if somebody is having seizures because of a brain tumor that is operable, the treatment for that patient might be to seek medical advice from a neurosurgeon to assess whether the tumor that they have in the brain is operable.
Yes.
Right?
Yes.
And then, of course, some people would have convulsions and seizures, but they haven't necessarily developed epilepsy. But for instance, for children who have infections and then their fever goes up, the temperature goes into 40 degrees, those are called febrile seizures. So if we treat the cause of the infection, then we will control the convulsions that this child has experienced. And there are others, of course, now where the problem, to be honest, is the problem of firing now.
Yes.
Okay, so their brain cells, which we call neurons, are firing more than they should fire. So most of those patients, which constitute the majority of the patients actually that have epilepsy, will benefit from medical treatment. Now, there are different classes of medications that are used to treat epilepsy, and those different kind of medications act on different areas in the brain.
Yes.
I wouldn't want to go into all the medical jargon around it, but is that there are specific medications that are fit for specific types of seizures.
Yes.
And I think this is where now I encourage patients to actually seek care from competent doctors, so that you don't end up finding that a patient with epilepsy is on a medication that is supposed to be very good for focal or partial seizures. Well, actually they have generalized seizures. And also there are patients, for instance, who have what we call absent seizures, right? These are usually, you see this in children and probably young adults or teens. For instance, they're having a conversation with their friends and out of a sudden they just stop, as if they're like looking at something that nobody else is understanding what they're saying.
Yes, like staring.
They're just staring.
Yeah.
And then out of a sudden, after like 1 minute or 30 seconds, they snap back.
Yes.
And they continue. So those are called absent seizures. And how you treat absent seizures is different from how you're going to treat focal seizures. It's different on how you're going to treat generalized seizures or epilepsy.
Yes.
So the short answer is there are medications that are adapted to actually treat epilepsy. Yes.
So you can, the best thing is to see your doctor.
Correct.
Be evaluated, then the best treatment is prescribed for you.
Indeed.
And there's epilepsy, like what age what age is affected by epilepsy? That's I was trying to reconstruct the question in my head.
Yes.
What age group is mostly affected by epilepsy? And then two, are there specific symptoms that varies per age, or the symptoms are constant and similar?
Yeah, most epileptic patients are young patients, okay? But there is no, that doesn't mean that if you're not young, you won't get epilepsy. Anybody can get epilepsy. But it is usually starts either from childhood and then developed in young adults, but everybody can get it. But that's usually the age group that people end up developing epilepsy. So the key factor is to know that mostly it's the young adults, but anybody can get it.
Okay.
So what are the symptoms? What makes you think that you have epilepsy? And to answer this question, we go back to the types, right?
Yes.
Because there are some people who would have epilepsy and the initial symptoms is just a funny feeling in the stomach. Okay? There are people who have epilepsy and they either get an uncontrollable fear. They don't understand why they're having fears. There are others actually who get some of the signs and symptoms of epilepsy that they get is overexcitement. Okay? Because it depends on what area in the brain is affected. For instance, if the area in your brain that controls your emotions is the one that is having the excessive firing, you can have people that are overtly happy. And they don't necessarily understand why that is happening.
Oh my.
And of course, now if you see these people and you don't know, it's easier to just characterize them as mental. They're having a mental illness or a mental breakdown. But actually, it's those subtle signs and symptoms that could be pointing towards epilepsy. So the message here is don't treat yourself. Okay? Get good medical consult so that you don't spend your time listening to people telling you that you need to stop being too excited or you need to stop being too afraid. But the other symptoms that we had already talked about, these are like even what Reverend Beuchi talked about. Some people can get flashes before even they have a convulsion. They have like flashes. Some people can be having like their arm rested and their arm is just jerk. Without them doing anything, and it's involuntary. And of course, then some people would have now the classic symptoms of jerking and stiffness of the whole body, and then falling down. Frothing of the mouth is something that is really common. Rolling of the eyes is also something that you can see with epilepsy. And then, of course, now losing the capacity to hold urine, and then loss of consciousness, that they don't remember what happened the moment they wake up. Now, also, there is something that happens to epileptic patients once the convulsion phase has stopped. These are patients that will go into what we call a post-ictal phase. That means they will sleep for hours and hours. And if you think about it, it's a mechanism of the body to kind of try to recover from the excessive energy it was using during the attack. So those are the few things that usually are the symptoms of epilepsy.
And Grace, I tend to think also with the symptoms, that's where so many people also draw a lot of these myths and misconceptions.
Talk to us about that.
Because the other day, a person was asking me, why do you think like people with conditions such as epilepsy are quick to go to traditional healers and waganga than going to the hospital? Like you'll have a headache and some of us don't even need a doctor to be told, go to the shop and buy, Panadol or headache. But why is it that when, it's epilepsy, in the manner in which it manifests through those symptoms, people will come there, they will pray for you, they will cast out demons.
And lay hands.
and if it's not spiritual, then you will be taken to these other places. And we are not saying like if something happens, people should not, pray. I should be the first person to advocate for that. I'm a reverend and I pray for these people, right? But, the understanding of epilepsy sometimes when you're talking about its background. I'm taken back to when Jesus, somebody was brought to him,
Yes.
this young man, and he had these seizures. And then clearly, even the Bible talks about it being epilepsy. And when the shadow of Jesus was cast on this person, it says the demons of epilepsy left the man. So you still have people who have the understanding like this condition in the manner in which it manifests, it cannot be a medical condition. You should see when my sister is about to have a seizure, the sound that comes from her. It's as if someone has attacked her.
Yes.
It's so scary.
Yes.
I tell you, if it happens here, I don't want to say that at some point I got used to it. It will always scare all of us. And the next thing, they are down. So, I mean, what do you call that? And that is the hardest part I've tried to like explain to people. Epilepsy is a medical condition. They're like, no way. Whatever happens to your sister, the eyes rolling, the sound,
They must
the
be like a demon getting out.
There must be something. And that is where now all these myths and misconceptions start to come up.
Yeah.
So it's good for people to understand, just like any other medical condition, there will be symptoms that, manifest through that. And for epilepsy, it would look like a scary thing, confusing thing, but that is just what it is.
Yes.
And you should not confuse that to be something else. Yeah.
And how did you, as a caregiver, shield your sister?
Yeah.
Because these are so many misconceptions coming through.
Really?
Some of them she gets to hear, some of them she experiences in terms of maybe people not wanting to associate with her. How have you been able to shield her for all these years and help her understand you're having a medical condition and there is help for you?
Unfortunately for her, because the condition started when she was young, it kind of like made her not to really get to comprehend it to a point where she would ask these questions. Because first, her speech was also,
affected.
Was affected. She wouldn't really speak out. But it got to a point where I would look at my sister, especially because she would fall down, she would hit her head, and she would just sit. She would not express any kind of pain. But it got to a point I would look in her eyes and you can tell this person is tired. This person is in pain. They don't just know how to speak it out. She would not cry. You would either, I think when the pain was too much, you would see like tears coming out. But she's not saying anything. You see, so over time, we needed to kind of like understand all that and be close to her. Like every time maybe a seizure happens and there's nobody to like hold her, you make sure you just forget about everything and sit with her until she's fully recovered. And that kind of concern and care was really working out for her because she would feel like not everybody is not doing their own thing. They are concerned about me for what has happened. And that is what kind of like built her up to where she is right now. So for families, this is what I would say, that these people need closer care. And the medication in itself is not enough to say that it will take care of this person, but to show that you are concerned, to show that you love this person, to show that anything that happens, you will be there to support and walk with them that journey. It is what brings about healing more, together with the medication that they are using.
And actually, sometimes people think that science and religion are opposing each other, but they actually embrace each other. And especially if you're talking at least from a perspective of a Christian doctor. Okay, I am a Christian and I practice medicine. So one of the things that I was taught in residency when I was doing my training in family medicine is that you have to look for the person in the patient. Okay, because sometimes doctors, we get too caught up with knowing the diagnosis, knowing the prescription, giving the right drug. And then we forget the person.
Yes.
Okay. This person needs to know, how am I going to take this medication? Do I have the right environment to even take this medication? So then you get to have patients that come over and over again in your office. They're not getting any better, but you're writing the right drugs. You're treating the right condition.
Yes.
But the social dynamics around them are not supportive enough for them actually to get better. And I think we need to always integrate those two parts, medicine on one hand and the social dynamics on the other hand, so that they actually integrate and come together.
Okay. Before we get to Dr. Gad, Reverend Beuchi, I'd love you to speak to caregivers.
Okay.
How do you take care of yourself from caregiving fatigue, which is common? You know, you've been doing this for all those years.
Yes.
You know, your sister is now a teen. Let's not reveal her age. Girls don't love their age being revealed in public. She's now a teen.
She's not.
How have you been able to take care of yourself? How has mom been able to take care of themselves?
You know, I would be lying if I say you don't get to a point where you feel like giving up and you feel like you've done so much, and especially when it's not getting any better.
Right.
So I would say for me, you know, what gave me the energy and strength to keep going was the fact that, you know, now she was on the correct medication and a proper diagnosis had been done. So there was hope every day. That is what motivates you to keep going.
Yes.
Otherwise, I would say, Grace, so many other times when she was on medication and still the frequency was after every 20 minutes, it felt like we were not going anywhere. I was getting tired, and that's why I kept waking up and saying, please, just God give us this one day.
Yeah.
If you give us this one day and then it still continues on the frequency of 20, I would know there's something that is working out.
Yes.
So to be honest, it was all about seeing progress.
Yes.
Every small progress was really giving us a lot of strength and faith. Otherwise, before I joined mom to take care of the sister, I saw it in my mom's face, eyes. She was tired. So it really makes someone to really sink in. But start with the proper diagnosis, follow the medication. That progress of this patient getting better is what is going to give you the strength to keep going.
Okay.
Yes.
Okay. So, Dr. Gad, before we wrap it up, my director tells me a few minutes to go. So what should be the first call to action if maybe on the road or in the office someone has epileptic attack? What should we do?
Okay. First of all, don't run away. Okay, don't run away from them, because sometimes because of the stigma, when people don't understand that this is a medical condition and they are associated to either some spirituality, they will tend to leave them alone. Okay, and if you do that, you're actually putting that patient or that person, that young child, that young lady, that adult person in danger. So the first thing that when they're having a convulsive a seizure, or then they're having an epilepsy attack, what you do is try to hold them down and take away anything that could potentially injure them. The right thing to do is that if they're probably wearing very tight clothes, make them less tight. Loosen them. Because the jerking and all the stiffness with tight clothes can make things worse.
Yes.
Another thing that is actually really important is lay them down on their side. Okay. Because sometimes when people are having a convulsion and they are not laid on the side, it is possible for them to even choke.
Yes.
Okay. But if they're laid on the side, then the choking hazard is not going to be that much. Another thing is you realize that most patients that are having a convulsions would tend to either try to bite themselves or bite their tongue. It's good to find something like a tongue, like even a small piece of plastic or wood to put between their teeth and their tongue, so that in that moment where they're trying to bite on something, they don't end up biting their tongues. We've seen in clinic patients that come with almost the whole tongue cut because when they were having the convulsion, they ended up biting their tongue. Now remember, in that phase that they're in, they don't necessarily feel that pain of biting the tongue because their consciousness is already impaired. And you, who is witnessing it, you are actually their helper at that particular moment. Okay? So those are some of the measures that can actually help patients to actually go through a convulsion and not necessarily suffer great harm as a result of the convulsion. Number two, if you are at a place where there is a near health facility, take them. Okay, be the good Samaritan, right? Be your brother and your sister's keeper. Bring them to a facility because some of these patients may convulse longer. And if they convulse longer and you don't bring them to the right facility where they can get oxygen supplementation, where they can get serial monitoring so that we can see what are the damages that have happened, how do we prevent other damages from happening, that can be very, very bad for that patient. So this is a message to everybody out there, okay? We are our brothers and our sisters' keepers. Nobody, no single family right now ever decided that their child is going to have a convulsion. And that means that I did nothing, Reverend Beuchi did nothing to not be that person that is having an epileptic attack. So if we have that mindset of being there for the people that are going through this, knowing that they didn't do anything to deserve it, we will help them more. And this will help even destigmatize all the misconceptions and all the myths around epilepsy.
And Grace, on first aid also, it's good to note that there's what we call first aid don'ts. Like restraining for generalized seizure, like restraining this person.
Like hugging them tight,
like when they're jacking. I've seen that happen so many times. Someone falls, they're jacking, and you call like the whole family to like hold them. I mean, if you have removed them from danger of water, of fire, and they're in an open space where they can't injure themselves, then don't restrain them. I think what's most important is make sure the head, is well protected, either under a pillow or you have just held it by your hand like that. And also not giving them any kind of drink or food when they are in that state.
Because they'll choke.
They'll choke. There are people who come with water and they want to kind of like, and even that putting of something, it needs to be very cautious. Because, the muscles have tightened and then you're trying to put something inside there. It sometimes can also cause a problem. So it's good to be cautious about that.
Okay. As we wrap it up, you're sharing your parting shot. We'll begin with Reverend Beuchi.
This condition is manageable, with treatment and medication. So don't shy away from taking, your loved ones to the hospital. And also express, the love for these people. Don't stigmatize them, because we have said here, it cannot be passed from one person to another. So don't say we will not sit with them on the same table, eat with them, go with them to church. They are people who also want, to enjoy all social activities out there. And for those that are able to go to school, take them to school. Those that have qualified to get jobs. I was just telling Daktari, people fear in jobs interview to say I have epilepsy, because the next thing the employer would be like, I don't want tragedy
in my watch.
In my watch. They are saying so that you can prepare an environment for them to work. They need the money to buy the drugs, for them to stabilize. So they clearly have rights just like any other person. And so to say that under the umbrella of National Epilepsy Coordination Committee, we're still on with the Angaza Kifafa campaign. This year we are looking forward to go to 4 other counties to do the roadshow caravans, to train the community health promoters and also the healthcare workers. And the question that people ask now in an interview like this is, where do we go for now for help?
Yes.
We try as much as we can to tell people any public hospital that's near you, even if they don't have those medicine, they would always have a way of referring you to a nearby one which has medicine.
Yeah.
The most important thing is for you to show up and say, I have been experiencing this, and so can I be guided on how I'm going to be treated? Otherwise, those that now have heard we are coming from Maua and Meru, we are trying our level best to see if they can visit Methodist Hospital one day. Maybe we would have set up an epilepsy clinic for them to get that treatment from that point.
Okay.
Yeah.
Thank you, Reverend Beuchi. Natari.
And right, even adding on that, before I give my parting shots, is that in Maua Methodist Hospital, there are good, competent doctors that can take care of these problems. And this really goes out to the community out there. Don't die alone. Please come to the facility to get care. Now, my parting shots are these ones. And I will say the most important question is, what would Jesus do? Okay. I usually ask myself that question when I'm in clinic, when I'm so tired, but I have a patient that is coming to my clinic. What would Jesus do? Would Jesus send that patient away, or would Jesus actually welcome that patient? So that is important even in the management of epilepsy. We remember that we are our brothers and our sisters, keepers. Number 2, please follow this episode and share it with your friends and family members all over, because this is how we create awareness. This is how we demystify things that are out there that are not necessarily true. Number 3, epilepsy is not a death sentence. You can have a very good life, a very stable life, if you take your right medication, if you have a good follow-up with a doctor that understands the condition. So please, people, don't despair. This is manageable. I have seen a number of patients in my practice that came to my office and they were having seizures, just like the sister to Reverend Beuchi was having these convulsions and repetitive. We started them on treatment. 1 month they're seizure free, 2 months they're seizure free, 1 year they're seizure free, 2 years, 3 years, 4 years, 5 years, 6 years, and they've resumed a normal life.
Okay.
Yes. One last thing.
Yes.
This goes to the mothers. If your child is convulsing, they usually say don't convulse with the child.
Yes.
And the way you don't convulse with the child is by getting knowledge, so you know how to handle it.
Yeah. Oh, mothers, I hear you on that. So really want to converse with our children. But get them help. Thank you, Dr. Gad and Reverend Beuchi, for gracing Health Check this day.
Thank you so much.
May the Lord bless you for the great work you're doing.
So much.
Yeah. When you arrive in Meru, say hi.
We will.
Okay.
All right.
And that's all we had on Health Check this day. And my take home is there is help for you. Visit any government hospital near you, any health facility near you, and seek help. Please do not hide. Do not run away. There is help for you, and you can live a fulfilled life even if you have epilepsy. My name is Grace Mutisa. It's been a joy serving you on Health Check today. God willing, let's do this again next week, same time, same station. Have a beautiful time and keep it Hop TV, where you look and live. Bye-bye for now.